Welcome to today's class on endocrinology. In this lecture, we will explore various topics related to thyroid nodules and their management. Thyroid nodules are a common clinical problem, with a significant proportion being malignant. Therefore, it is essential for medical professionals to stay updated on the latest molecular profiling techniques, diagnostic biomarkers, and treatment options available. Our discussion will cover 12 important areas, each providing valuable insights into the complex nature of thyroid nodules and their implications for patient care. Let's dive right in. Thyroid nodule evaluation has greatly benefited from the emergence of molecular profiling techniques in recent years. These methods involve the analysis of gene expression patterns, genomic alterations, and mutations within the nodules. By understanding the molecular characteristics of these nodules, clinicians can better classify them as benign or malignant, improving patient management decisions. Efforts are underway to identify novel diagnostic biomarkers that can aid in distinguishing malignant thyroid nodules from benign ones. These biomarkers include specific gene mutations, microRNA expression patterns, and proteins that play a significant role in tumorigenesis. Understanding the utility and limitations of these emerging biomarkers is crucial in optimizing patient outcomes. Next-generation sequencing, NGS, technologies have revolutionized the field of molecular diagnostics. NGS allows for the simultaneous analysis of multiple genes, enabling a comprehensive evaluation of genetic alterations associated with thyroid nodules. We will discuss the clinical applications of NGS in risk assessment, prognosis prediction, and treatment selection for thyroid nodule management. In the field of radiogenomics, which is a combination of radiological imaging and genetic information, researchers analyze the radiological characteristics and genetic changes in thyroid nodules. This approach allows us to gain a deeper understanding of the biological behavior and potential for malignancy in these nodules. By using radiogenomics, we can improve the accuracy of diagnosis and develop more effective treatment plans for patients with thyroid nodules. Precision medicine aims to tailor treatment strategies to individual patients' specific characteristics. In the context of thyroid cancer, advances in precision medicine have led to the identification of molecular targets and the development of targeted therapies. We will delve into the latest advancements in precision medicine and discuss their impact on patient outcomes. In the realm of thyroid nodule development, various genetic mutations and signaling pathways play a crucial role. These molecular changes significantly influence essential cellular processes such as cell growth, differentiation, and apoptosis. Gaining a deep understanding of these intricate mechanisms allows healthcare professionals to assess the potential malignancy of thyroid nodules more accurately and develop appropriate management approaches. This knowledge equips physicians with the necessary tools to provide optimal care for patients with thyroid nodules. As we delve into the realm of advanced thyroid cancers, it is essential to consider targeted therapies, as conventional treatments often encounter resistance in these cases. There are several promising agents worth exploring in the field of advanced thyroid cancer treatment. One notable class is tyrosine kinase inhibitors, which work by inhibiting specific enzymes involved in cancer cell growth. Additionally, immune checkpoint inhibitors have shown potential in activating the body's immune system to target and kill cancer cells effectively. By delving into these targeted therapies, we aim to broaden our understanding and improve outcomes for patients with advanced thyroid cancer. Immunotherapy, a promising treatment modality in various cancers, has shown potential in the management of aggressive thyroid cancers. Specifically, immune checkpoint inhibitors have gained attention in the field. These inhibitors work by harnessing the body's immune system to target cancer cells more effectively. We will dive into the mechanism of action behind immunotherapy, its clinical efficacy in treating aggressive thyroid cancers, and the potential side effects associated with this approach. Stay tuned for an in-depth exploration of this exciting development in cancer treatment. Positron emission tomography/computed tomography, PET/CT, plays a vital role in the evaluation of thyroid nodules and goiter. By utilizing radiotracers, PET/CT can provide valuable information regarding metabolic activity, staging, and the presence of distant metastases. We will examine the current indications and limitations of PET/CT in the context of thyroid nodules and goiter. Thyroid nodules often pose difficulties in clinical practice due to their tendency to recur. In order to better understand this phenomenon, it is important to examine the molecular mechanisms underlying nodule recurrence. Moreover, we need to discuss the existing strategies for managing recurrent thyroid nodules, which may involve repeated surgical interventions or considering alternative therapeutic options. By exploring these aspects, we hope to provide a comprehensive overview of the challenges associated with thyroid nodule recurrence and the possible management strategies to address them. Surgical resection continues to be a fundamental treatment method for thyroid nodules and goiter. In this section, we will explore the latest advancements in surgical techniques, including less invasive approaches, such as minimally invasive procedures, which involve smaller incisions and faster recovery times. Additionally, we will delve into the benefits of using robotic assistance during thyroid resection, which provides surgeons with enhanced precision and control. Furthermore, we will discuss the importance of incorporating nerve monitoring systems during surgery to safeguard the delicate recurrent laryngeal nerves. Familiarizing ourselves with these innovative techniques is of utmost importance in ensuring optimal surgical results while minimizing postoperative complications. This approach involves the integration of various factors such as patient age, family history, nodule size, imaging characteristics, and the presence of specific molecular markers. By considering these factors together, we can more accurately assess the likelihood of malignancy and guide appropriate treatment options. This personalized approach to thyroid nodule management aims to prevent unnecessary surgeries and improve the overall patient experience. Furthermore, advancements in molecular testing techniques have allowed for the identification of specific gene mutations associated with thyroid cancer, which can further refine risk assessment and guide personalized treatment decisions. In conclusion, the management of thyroid nodules requires a comprehensive understanding of molecular profiling, diagnostic biomarkers, radiogenomics, targeted therapies, surgical techniques, and risk assessment. By staying updated on these topics, medical professionals can provide optimal care for patients with thyroid nodules. Remember to continue expanding your knowledge and embracing advancements in this ever-evolving field. Thank you for your participation, and I wish you success in your future medical endeavors.